This is Andrew Goodman from Dentistry Today, and we're happy to be here at the Axis Dental booth with Dr. Miyazaki. And what are you going to be showing us today?
We're going to discuss the Axis Dental's kits to polish and adjust both Emax restorations and zirconia restorations. Again, I think in dentistry, especially with aesthetics, Emax being a lithium disilicate and having great strength, and then a zirconia, now we have a monoblock restoration that's just pure zirconia, again, very, very strong, rivaling the strength of PFM restorations. I think the placement of these types of aesthetic restorations is just becoming more and more commonplace. But the difficulty with these restorations being so strong is how do you adjust them and polish them? And Axis Dental has come up with some great kits to help us do that, and that's what we hope to show today.
Okay, you want to give us a demonstration?
Sure, that'd be great. Why don't I first show you the different kits that, we've got 3 different kits from Axis Dental. One is a bite adjustment and polishing set, the Ceraglaze system. Works very well with the Emax restorations. All right, so we'll take it from an unpolished surface. And again, I'm using the green, which is the coarsest of the finishing. And you can see that we're taking that restoration that had the kind of the rough looking surface, and the shine is already starting to come through. So as we do that, we're just going to polish out the buccal this restoration. And that shine's coming out. And the nice thing, especially with this kit, is it's got the diamonds so you can do the gross adjustments. And with the Zir-Cut system on zirconia, the way the diamonds are fabricated and the way the polishing works is to avoid chips and fractures of the restorations, including microfractures, which again will affect the long-term durability and strength of the restoration. So we're starting to pick up that shine, and what we can do is we can go to the next finer grit. And it shouldn't take long, especially because it's a kit. And the kit is designed so the diamonds will do the shaping without creating a lot of deep scratches in the restorations. And they just go back over. First one is to get out the deep scratches. This one again is to begin polishing it up. And the last one to create more of that lustrous shine that we want for our patients. Again, in the posterior for better wearability especially against the opposing dentition. And in the anterior, of course, for that shine that we're looking for. Emax is a material that I've been using for everything from crowns, inlays, onlays, and veneers. It's really become kind of my go-to material. Zirconia is great for those doctors that are afraid of putting anything but the strongest, especially on second molars, and they want something that's very aesthetic. So then we're just going to the finest just to kind of put that final shine on. And again, this was an unglazed, unfinished restoration, and we're getting a nice, I'm not sure how well it shows up, but we're getting a really nice shine there. So and this is with the Emax and the Ceraglaze system. We move on then to the Bruxer. Let's see. So again, with the zirconia restorations, we either have the kit that has the diamonds that you can use to adjust the occlusion, maintain the shape of your crowns, inlays, onlays, whatever your type of zirconia restoration you have, and then the polishing cups. And it's just a 2-step system, again, with that very innovative diamond mix that polishes the zirconia up. So, or you can get the polishing kit made, the Zir-Cut polishing kit, that again has the different shapes, has the point, the disc shape, and the cup. So why don't we do the same thing? We'll take, again, one of Glidewell's Bruxer crowns. It's an all zirconia monoblock. And we'll start off with the crown that has not been finished up. And we start with the green. And just to keep it consistent, why don't we use the green cup, since that's what we did with the Emax. And so we have the frosty surface. And I'm just going to go over that frosty surface just quickly. And if we're doing this in the patient's mouth, we would want to be sure that not to generate any kind of excessive heat. Probably have the assistant blowing a little bit of air and holding the suction there just to keep that area cool. But you can see again that shine that's already coming out. And this was an unfinished zirconia restoration. Was not glazed, and now it's developing that glazed shine. And that's what we want to do. So again, this would be especially important on the occlusal, but I'm doing it more on this large buccal surface so we can see the effect of these polishers. It'd be harder to get lost in all the occlusal anatomy if we did the occlusal. But I can get into that buccal groove with this cup. I use the edge, can use the flat surface of the cup to get the broader areas. So just quickly, now we're starting to pick up that shine, and then I will move on to the final polisher. And again, the nice thing being it's just a two-step system, so you don't have to go through a lot of different steps. In a dental practice, steps means time, and time means money. Let me get this on. There it goes. Move that out of the way. So we've used the green. The green gets rid of the larger scratches the diamond may have left during the adjustments. And now we're just creating that high lustrous polish. So from where I am, hopefully the camera can catch this, we're picking up a nice shine. So again, you can see this is zirconia, so it's a very strong material, high strength, and yet we're able to take it from that frosty surface to a very nice glazed surface, fast and quick. All right.